On the strike, and the psychiatric hospital nurses at the Accra Psychiatric Hospital have called off their strike following an assurance for them to be paid in September by the Minister of Employment and Labour Relations, Haruna Idrisu.
According to the minister, he has requested the Auditor General to speed up with the verification and validation of names of the nurses for payment to begin.
A day after the strike, the Minister of Employment has requested Fair Wages and Salaries Commission to properly examine the issues of the pharmacists.
Matters of remuneration and allowances are negotiated. A number of them, like Category 2 and 3 allowances, have been referred to the Fair Wages and Salaries Commission and the Compensations Department of the Ministry of Finance for the
and Labour Relations Minister gave the assurance when he visited the psychiatric nurses in Accra.
Trust that I'm unable to tell you it will be done in 2 weeks or in 2 days, but at least by the end of September next month, all outstanding issues would have been cleared. When I say September, I want to be as sincere as possible. On my way here, I discussed with the Auditor General, which is doing an audit of the verification further. I've asked them to liaise with the Ministry of Health, HR Department. The Control Accountant General is ready to start imputing and computing, finalizing your name for salary. Some of you may get it earlier, but I don't want that instant. I want all of you to be processed as bulk.
Although the nurses were not happy with the September payment, the minister pleaded with them to accept the offer and urged them to call off their strike.
I'll monitor health, controller, finance at every minute going forward to make sure that you get your money like the junior doctors get. Be assured and kindly reconsider your decision and don't consummate the threat of the strike action. Don't proceed further. You will be paid.
The sector minister later toured the facility.
Earlier at the Accra Psychiatric Hospital, outpatient cases were many following the sit-down strike by nurses.
According to the acting medical director, Dr. Adra Apu, the hospital was relying on mental health aides and rotational nurses.
Patients loitered at the premises of the Accra Psychiatric Hospital. On the second day of a sit-down strike, psychiatric nurses would not budge at any call to see to patients. The hospital has a nursing staff strength of 250, out of which 190 are on a sit-down strike demanding their salary arrears. Doctors at the hospital, like their colleagues in other public hospitals, are also on strike and only attending to emergency cases and patients on admission. But with the special nature of their jobs as psychiatric nurses, how is the hospital coping?
What we've done actually is to bring in, we have rotation nurses around, and then we have some health aides who are helping, but the work has been difficult. We are trying to reschedule the few ones we have to spread them through the hospital so that we don't feel the impact too much. Fortunately or unfortunately, the doctors are on strike, so we are limiting the admission so that we don't have too much work on the wards for the patients, for the nurses in there.
Some recuperating patients were also giving a helping hand. A staff nurse, Emmanuel Fibri, reiterated their grievances, saying they understand the impact of the strike but remain resolute.
For us, it's never our intention as essential workers to go on strike. We never like that word because no lives are involved. Those who come here, they can be our relatives. In fact, we ourselves, we even get sick and we'll go. At the point in time, you're staff. At the point in time, you're a patient. So we care about them. That's why we're even starting with a sit-down strike. So by Friday...